I'd like to introduce myself by giving you a clue. When people meet me for the first time, they say, "Oh, so you read minds?" I, Neha Cadabam, no, I don't read minds, but I am a psychologist. How are you all doing today? Excellent. It's been more than a decade that I've been working with children and teens, and 9 out of the 10 times, this is what I hear: fine, good. But do we take a moment to think and reflect back? How is it that we're actually feeling? Am I feeling great? Am I excited? Am I upset about something? I'm really tired today. But why is it that without even taking a second to think, we just say, I am fine? I think we all as children have been taught that. When children are taught to say, I am fine, there is a disconnect from within as to how am I actually feeling at the moment. And I think we all as a society have to bring this change where children are able to comfortably identify their emotions. What is it that I'm actually feeling? How complex emotions can be. Understanding self. Who am I? What is it that I want to become? Am I comfortable in my own skin? And then the next point, which is interpersonal dynamics. How is it that I connect with others and others connect with me? And finally, be able to comprehend the fine line between I am doing great, I'm coping, I'm managing, I am breaking down to I am fine. I'd like to share with all of you all my journey as a psychologist. When I sit in the counselor cabin and meet teens and children and young adults, the issues that they talk about have started way long back. All that has happened is the issues have been pushed under the carpet. And I felt so terrible. I wish there was something that could be done to ensure these issues were addressed way earlier before they came here. And that's when I ventured out into preventive and promotive mental health. When I say preventive and promotive mental health, I mean the child doesn't need to have an issue, a major issue. It could be a small instance. Someone laughed at me. My confidence broke. I'm having low self-esteem. Someone mocked at me. I got bullied. Those small issues that put together and mount to become a big issue. So the preventive and promotive mental health is applicable for absolutely everyone. It does not have to be a person who has an issue. In fact, research has shown that 50% of the psychological disorders begin before the age of 14, and 3/4 of it begin before the age of 18. You should also know that 1 in 5 children have and experience behavioral and emotional issues. And how many of them do you think actually get the help? I'm now going to bring out 4 ways we all can take to be able to help the children improve their emotional and mental health. The first being mental health curriculums at school. Let me ask you all a question. How many of you all remember having a counselor in your school? Very few hands, but don't worry, you're not alone. In fact, 93% of schools in India does not have a professional counselor. And some of the schools where there is counselor, they are mostly doubling up to be a teacher or a career counselor. Since the years that I have been talking about long-term and structured mental health curriculum, I remember one of the conversations that I had with a stakeholder of the school. She told me, why should I invest into a mental health curriculum? I rather spend that money on a science lab or sports facilities. I might be aiding a scientist, a future scientist, or a future gold medalist. What are people going to think if I have a mental health curriculum in my school? They're going to laugh at me. They're going to think I run a special school. We all understand, and I think there is enough and more research that tells us mental health is important and mental health care is important. The gap there is way too much. I failed to explain that to her, but I continue. And I think the need for mental health curriculum and mental health programs today is even more. The fast pace at which the society is changing, access to technology, changes in family structure, and finally, the pandemic. Pandemic has forced all of us to stay indoors, restricted the explorers in us, and impacted all of us greatly. And that's why I think it's very important for all of us to be able to access and enhance positive mental health, and a great way to do is by having structured and long-term mental health curriculums in school. While I say that this has to happen at school, it also has to happen at home. I remember a child came to me once and said, "I'm so glad I finally got to meet you. I have been wanting to meet a counselor for the longest time." And I said, "When you know it, why didn't you meet someone earlier?" And he said, "I talked to my parents, and they said, in our family, no one has ever gone to a counselor. How can you? Are you crazy? If you have an issue, talk to me." There was another child who came to me and said, "I have been bullied multiple times over the years." And I talked to my parents and they said, "Bullying is a part of growing up, figure it out. You don't need to go to a counselor for every issue you may have." This is what I'm talking about. We all have to understand, like we very casually and comfortably talk about dental hygiene, healthy habits, physical fitness, why can't we talk about the mind? It is very important that we all start having conversations, comfortable conversations about mental health and feel comfortable to meet a counselor. My elder daughter, she's 7 years old. She saw me hassled the other day and she came to me and she said, "Ma, can I tell you something?" And I said, "Go ahead." She said, "Remember, if you ever feel like you want to talk to someone, you can talk to me." And I was surprised that one sentence can make so much of a difference. And that's what we need to do. I think as adults and as parents, we have to show that we are not superheroes. We too have meltdowns, outbursts, and even failure. And we have to talk about it openly. Moving on to the next point. As a mother of 2 beautiful girls, I have always wanted to do everything I can to make sure that they're protected and they're safe. And I know I can't do that all the time. And that's when I asked, what is it that I can do to make sure they're stronger from within? And that's when I thought, what better way than fuse creativity and games that are both indoor, outdoor, activity-oriented, absolutely anything. But kids will learn amazingly well when it's fused with games and creativity. This is what the outcome was. We did some craft work where we were exploring and understanding self-awareness. This was another kit where we said when we feel low, when we're feeling upset, when we're feeling sad, what are the things we could do? This may not be possible in every home, every time, but we can definitely see how we can bring this. In fact, I've been using these creative tools, even in schools, and the impact it has on children is phenomenal. Emotional and mental health is not something that I can teach with a book or with a presentation. It has to be a skill that is understood and learned and experienced. Moving on to the last point, which is emotional first aid at school. How many of you all understand and know some basic physical first aid techniques? And how many of you all have even heard of emotional first aid? I barely see any hands. This is what I'm talking about. My younger daughter, she's 1.5 years. The other day, she was running and she hit her head to the edge of the table. She came running to me crying. She said, "Ma, hurt, ice." And I was amused to see how a child as young as that is able to comprehend and understand basic physical first aid. And so we all understand to deal with physical injuries immediately as a first aid. But we don't understand what to do with an emotional injury. An emotional injury such as a loss of someone, a breakup, a toy broken. I'm feeling very upset about someone who went away. There are so many emotional injuries that we all go through. And we don't know, we clearly don't know what are we supposed to do, either for ourselves or for someone else. I think a good start for emotional first aid would be to equip teachers and teaching institutions about how emotional first aid can be done. When I see a child crying in the class, when I see a child throwing a temper tantrum, when I see a child getting angry and walking out of the room, as a teacher, what is it that I can do? Teachers interact with so many students and actually make so much difference to their life. I think getting teachers to learn some of these emotional first aid techniques and practice them will be a great leap start to make a difference. And when we're able to put all of this together as a community, as a society, we will be able to enhance and improve the emotional and mental health of children and improve their quality of life. And I can assure you that after this, the answer of a child to "how are you" will be way beyond "I am fine." Thank you.